of anesthesia. Respected seniors, colleagues, ladies and gentlemen, good afternoon. It is both a privilege and a matter of great pride for me to stand before you today at the inauguration of the digital airway management tool at Rangaraya Medical College, Kakinada. This event marks not only the launch of a new teaching gadget in our department but also a small yet significant step in the evolution of anesthesia training in our region. Why this matters? Airway management is the cornerstone of safe anesthesia practice. In our daily clinical work, we encounter patients with difficult airways, limited resources, and time-sensitive decisions. A well-trained, confident anesthesiologist can make all the difference between a smooth case and a life-threatening crisis. The digital airway management tool that we inaugurate today is designed to standardize airway assessment and decision-making, simulate various clinical scenarios that trainees may not frequently encounter, provide instant feedback and reinforce evidence-based algorithms. In other words, it is not just a digital gadget, it is a virtual mentor for every resident and junior doctor who walks into our operating theaters, bridging the gap between theory and practice. At Rangaraya Medical College, we have long emphasized hands-on skill training. Our department has been actively involved in workshops, CMEs, and skill lab sessions on airway management. Yet, theory and practice sometimes remain disconnected. This digital tool bridges that gap by allowing residents to practice airway decision-making in a risk-free environment. Repeating complex scenarios such as anticipated difficult airway, emergency front of neck access, and failed intubation algorithms, integrating current guidelines from national and international bodies so that our teaching stays updated and standardized. Thus, we are not only modernizing our teaching methods but also aligning our training with the expectations of modern, evidence-based anesthesia practice. A step toward innovation and indigenization. Beyond education, today's inauguration symbolizes our commitment to innovation and indigenization of medical technology. In a country where healthcare resources are often limited, we physicians must think creatively, design frugally, and adapt smartly. This digital airway management tool is a product of our own efforts, developed here, fine-tuned here, and ultimately tailored for the needs of our students and patients. It reflects what is possible when clinicians, educators, and technology come together with a shared purpose. I hope this initiative will inspire further collaboration between our department, the Skill Lab, and even our engineering friends to develop more such tools, whether in airway management, regional anesthesia, or critical care. To our students and future anesthesiologists, dear residents and interns, today's event is as much for you as for us. This digital airway management tool is your playground for learning. Use it not only to pass exams, but to build competence, confidence, and clinical judgment. Remember, no tool, digital or mechanical, can replace sound knowledge, meticulous technique, or human responsibility. However,